5 ways to reduce fluoride consumption. One-stop drinking fluoridated water. Tap water consumption is, on average, the largest daily source of fluoride exposure for people who live in areas that add fluoride to the water. Avoiding consumption of fluoridated water is especially critical for infants. If you live in an area which fluoridates its water, you can avoid drinking the fluoride in one of 3 ways. Water filters. One way of avoiding the fluoride from tap water is to purchase a water filter. Not all water filters, however, remove fluoride. The 3 types of filters that can remove fluoride are reverse osmosis, deionizers which use ion exchange resins, and activated alumina. Each of these filters should be able to remove about 90% of the fluoride. By contrast, activated carbon filters e.g., Brita and Pur do not remove fluoride. Spring water. Another way to avoid fluoride from tap water is to purchase spring water. Most brands of spring water contain very low levels of fluoride. Some brands, however, do contain high levels, e.g., Trinity Springs. Before consuming any bottled water on a consistent basis, therefore, you should verify that the fluoride content is less than 0.2 ppm, and ideally less than 0.1 ppm. You can find out the level of fluoride level in some of the popular brands here. You can also find out the fluoride level by calling the number on the water label. Most companies have this information readily available. Water distillation. A third way to avoid fluoride from the tap is to purchase a distillation unit. Water distillation will remove most, if not all, of the fluoride. The price for distillation units varies widely depending on the size. Small countertop units cost as little as $200, while large units can exceed $1,000. If you don't know if your area is fluoridated, you can find out by contacting your local water department. If you live in the U.S., you can also find out by going to FAN's state fluoride database. Don't let your child swallow fluoride toothpaste. Fluoride toothpaste is often the largest single source of fluoride intake for young children, and is a major risk factor for disfiguring dental fluorosis. This is because children swallow a large amount of the paste that they put in their mouth. In fact, research has shown that it is not uncommon for young children to swallow more fluoride from toothpaste alone than is recommended as an entire day's ingestion from all sources. If you have a young child, therefore, we recommend that you use a non-fluoride toothpaste. If, however, you do use fluoride toothpaste, it's very important that you supervise your children while they brush to make sure they use no more than a pea-sized amount of paste, and that they fully rinse and spit after they finish. And, lastly, do not purchase candy-flavored toothpaste, e.g., bubble gum and watermelon, as these toothpastes, which still contain adult-strength concentrations of fluoride, increase the risk that your children will swallow it and actually want to swallow it. 3. Do not get fluoride gel treatments at the dentist. Although dental researchers have stated on numerous occasions that fluoride gel treatment should only be used for patients at highest risk of cavities, many dentists continue to apply fluoride gels irrespective of the patient's cavity risk. The fluoride gel procedure requires the patient to clamp down on a tray for 4 minutes and uses an extremely concentrated, acidic fluoride gel, 12,300 ppm. Because of the fluoride gel's high acidity, the saliva glands produce a large amount of saliva during the treatment, which makes it extremely difficult both for children and adults to avoid swallowing the gel. Even when dentists use precautionary measures such as suction devices, children and adults still ingest significant quantities of the paste, which can cause incredibly high spikes of fluoride in the blood for up to 15 hours. These fluoride levels place patients, particularly children, at risk for stomach pain, nausea and vomiting, and places the person at risk for short-term kidney damage, harm to the reproductive system, and impairment to glucose metabolism. The next time your dentist asks you whether you want a fluoride gel treatment, say number 4. Eat more fresh food, less processed food. When water is fluoridated, it is not just the water that is fluoridated, but all beverages and foods that are made with the water. As a general rule, therefore, the more processed the food is, the more fluoride it has. The good news is that the naturally occurring levels of fluoride in most fresh water, e.g., spring water, and most fresh food, e.g., fruits, vegetables, grain, eggs, milk, is very low. Use this fact to your advantage by trying to shift as much as you can from processed foods to fresh. Also, since processed beverages, e.g., sodas, Reconstituted juices, sports drinks contribute far more to fluoride intake than processed foods. It is most important to focus on reducing your consumption of processed beverages. 5. Buy organic grape juice and wine in the United States. Many vineyards use a fluoride pesticide called cryolite. As a result, the levels of fluoride in U.S. grape juice and wine, particularly white grape juice and white wine, are consistently elevated. Indeed, in 2005, the USDA reported that the average level of fluoride exceeded 2 ppm for both white wine and white grape. The levels of fluoride in red wine are also elevated 1 ppm, and so are raisins 2.3 ppm. If you buy grape juice and wine, or if you are a heavy consumer of raisins, buy organic. In the case of wine, if don't want to spend the extra money on organic, consider purchasing a European brand, as Europe uses far less cryolite than the US. 5 ways to reduce fluoride consumption. 1. Stop drinking fluoridated water. Tap water consumption is